Thank you, and Catherine, and thank you for your kind invitations. So, I would like to talking about innovation of 3D and image and processing visualization for intelligent minimally invasive and diagnosis and therapy. I'm from Tsinghua University and Beijing. So let's outline on my talk. I was talking about the background of medical image and application in biomedical engineering. So I will introduce an novel and 3D and image is kind of autostereoscopic image based on integral and videography. So have some related and technique and related to the high quality and high accuracy really 3D and display. So also the rendering and the high speed and the rendering and interactive and the 3D and the medical device and systems. I will show some and application using the AR technique for the image guided surgery, and also have some 3D and optical image and for the therapeutics. So as we know that there's a lot of new technique have been developed for intelligent and medicine. So such as the biomedical and information, biomedical and measurement, diagnosis, and the treatment. So you can see there are a lot of technique include the micro and the diagnosis robot and the diagnosis chip for the health manager and the monitor. And also they combine this and the medical device for the minimally invasive and the surgery. So you can see it such a technique from the biomedical and the image to diagnosis, then treatment. So how can we combine this kind of technique for very precision and the high and accuracy and the treatment for the target? So we can see that a lot of the conventional image and analysis and the guidance technique. But the problem, and I can show here, when we use the image for the image and guided surgery, you can see the position of the image and the real and the position of the target, for example, the tissue or the tumor is different from each other. So can we make this image to patient more high accuracy? So because the accuracy is very difficult and it prevent the damage from the small, but it's very critical and the structure. So you can see it, how can we improve the quality, especially for the use in intraoperative and the use in image and guided and surgery. So as we know that we have a lot of image and technique, for example, and it's covered from the multi-modality and multi-scale and the medical image from the organ to tissues, and for the target of, for example, the molecular and the image. So we can get a high resolution and image and information for the accuracy and the diagnosis. But how can we guide use this image for guidance during the operations? So I will show some technique and related to the 3D and the image. If not, for example, we can have some image like this one. We have get the information and displayed in the 3D and the displays, and then use the image for the guidance during the operations. Also, we can include the image and analysis for intelligent and image and use in during the operations. So we want to make the image from the diagnosis to the therapy. So especially for the intelligent accuracy and image and the diagnosis and the treatments. So we can see then they have some a very long and history for using the medical image in the operations. But then the traditional image have been used. Even we can get the 3D information and in pre-operative and operations, but the image just show in the two-dimensional display like this one, like the middle image in here. So the surgeon have to reconstruct the 3D and the information in their mind. So and get the 3D and the structure of the target. So can we improve, for example, we can show the image in the 3D and the display, and the image was displayed in 3-dimensional in the space that coincide with the patient's body. Like, so you can get a more intuitive and accuracy of the image and during the use in the operations. There are a lot of 3D and display. For example, compare with the traditional medical and displays, you can see that we can use the 3D and the slicer and show in the screen. So we also can make a 3D and stereo and display with the viewing and the glasses, but it's very difficult from the visual and the fatigue. For example, the information have no motion polarities. Just show has some like the intuitive and the image, but it's not a real 3D and the image. So there are a lot of some other technique, for example, with use for the autostereoscopy and the display, with the 3D and the volume display, holographic display, and also the optical and grating, and with the lens array. So, but then there are some short and some limitation for use in the operations. So we develop a novel display based on the integral and the photograph. And 20 years ago, then we just use the lens array to, you can see then this movie. For example, when we record a beating heart, so we have a lens, it's micro-convex lens like this one. So you can see the light pass through the center of the lens and record in the focus and the point. So when we have a lot of lens like this one, so you can see it, a lot of lens is a kind of lens array. So the information can be recorded in the focus plane. So when we use the computer to calculate such an elemental and the image behind the lens, so after the calculation, we show the image here with a high density and the 2-dimensional display. So you can see the pixel can pass through the center of each lens and intersect in the original point. So when you see that from this feed, we can get the whole information of the 3D and the object. So you can see that this kind of technique can be make geometrical and accuracy can be viewed by the several people and at the same time. So it also freed from the visual and the fatigue. It's visible and it's full with a full motion polarities. So how can we use this 3D display in the medical and in the medicines? So you can see the merit is very we don't use lens and the viewing glasses. The free and the viewpoint is free and it can be viewed by the several people, and the image is very high and accuracy in the geometrical and the 3D and the space. So compare with the stereoscopy and the holography, and the image can be easy to be used in the medicine, especially in the image and the guided and the surgery. So I can see then show some example of our display. This is a display. You can see we move the camera and from the left to right, you can see it. So we can get the whole and the information and with the full and the motion analysis. So we can also make animated 3D and display and with a field the beating heart, the animated image with the motion analysis. So you can see then we have made such a display and with the full and the motion analysis and show in the autostereoscopy and the display. So this and the video and just capture about 20 years ago. Then so some application, and we also have some demonstration in the Hanover 2000 and 2000 years, and in the Hanover and the export, and yeah. So here's some interactive and 3D and displayed. As you can see it, we can move the model. The left side of this and the movie is in the 2-dimensional display, And the right side is the 3D and the display, is our 3D display. This movie also shows some motion paralysis. So you can see then the image can be captured within the move field and the eyes from left to right to get the whole information of the 3D and the object or the 3D image, just like a real and the object. So you can see then the image can be viewed by several people and freed from the visual and the fatigue, and so it's very and good and condition to be used in the medicines. In recent years, we also made a floating and autostereoscopy and displayed with the multi-dimensional image for the telesurgeon and visualizations. So you can see then we have a free and floating and 3D and displayed can be viewed by the from the 360 degree with a full motion paralysis. So you can see that the image and the device can be viewed and during the telesurgery. So you can see some demonstration. The image and the showed, and we can move the camera from left to right and to get the whole information of the 3D and the 3D object in the 3D and the space. So just like this one. So we can also combine the two-dimensional and the video and the 3D and the image and into the visualization and the system like this one. We also can check the position of the patients and get the information for the image and the guide and the surgery. So for the display and how can we make a high and a resolution and a high speed and the display. So for the high and the resolution, we also made a multi and a layer and a multi-frame live view and a display like this one. So you can see that we can make a very high quality and a display, and it's a kind of autostereoscopy and a display like this one. Wait for a minute. So you can see then this video and show the horizontal and the paralysis of our display. The quality and have been improved. So is it the vertical and the paralysis or the 3D and the image is a high quality and the image. You can see then we can make a very large and displayed with the full motion paralysis and with a high quality and the image. And so you can see that we also made a high speed and the rendering for the real time and the 3D and the shadowing. For example, we have developed a new algorithm from the multi and the viewpoint to the rendering based and on the lens, so we can make a more faster and than the traditional mask. This is our display. So you can show that it's a kind of a prototype and the smooth and the motion paralysis. So you can see we can move the camera, so we can see the different and the side of the 3D and the image. So here shows some and the image and the quality, the improvement of the image and the quality. So you can see that it's a super and the multi-view and the displayed. So we can use a lip motion and to capture the structure and the movements like this one. So you can see that it's very faster, can be made 50% and 50 frames per second, and also maybe can make a high and quality and the image like this and the movie showed, and it's hard. So compare with the traditional MS, it's just under 1 frame per second. We can make under 20 frames per second, very faster and high quality and the 3D and the display. And this, so here. So for the application and also we can combine the pre-operative information with the intraoperative information. For the use, the interactive and the 3D and the medical and autostereoscopy and navigations like this one. So you can see here shows some this is the structure or how to combine the 3D and the point or the intraoperative and the data with the pre-operative and the 3D and high quality and the data. So you can see it, we use the camera to capture the structure, to capture the surface our 3D object, and then we can combine the capture image with the pre-operative and the image. So show here. So you can see then the result and show the multi-information based on the 3D display, and the display with the interactive. You can see that we can move the 3D object, and with a needle insert the locations, but we can make interactive and visualization for the whole informations. So the second one is then how can we use this kind of 3D image during the operations? So you can see then we have some work. We have some work on the outer stereoscopy and the base outer augmented reality and the fusion, like this one. Because then you can see then during the image and the guided surgery, we have a good quality and the 3D and the display, and but then the traditional and the use are the medical and the image, like this one. The surgeon have to shift their view from the screen to the surgical area. So this is cause the hand-eyes coordination and the problem in the image and the guided and the surgery. So how to achieve more intuitive and accuracy image visualization during the operations? That's the question one. Another question is then how to increase the accuracy and the definitions in the image and the guided and the surgery. So we develop such as a system. We use a half silver mirror to refresh the image, the 3D image, into the patients. So the surgeon can see through the patient. They can get in both the information or the 3D image inside the patient, and also the situation of the patient during the operations. Like in this video, you can see it from this window. We can see through the body. You can see that we can see the beating heart. From even and we move the eyes from left to right, from up to down. The image is showed inside with the patients from this window, and we can see the beating heart, so that the patient can perform the minimally invasive treatment and with the guidance of such as the windows, viewing and the windows. We also can check the structure, the position of the surgical and instrument. So you can see that when we insert the surgical instrument into the patients, the inside position of the surgical instrument can also be showed here. So they can be showed and combined with the structure or the target, for example, the tumor and the vessels. So you can see it, and we can make such as a guidance for the immediate and guided surgery, especially for the minimally invasive surgery. So you can see then we can capture the capture position of the project 3D and the image, and then we can make a patient image and registration like this one. The registration can be made automatically. You can see then we just capture the structure of the patients, and the image can be coincide with the patients after the registrations. So you can see and even we have moved the camera with our viewing and the point, we can get the whole information inside the patients. This is application as clinical application or in the neuro and the surgery. This is a human and it's a tumors. This is the type and it's the markers. And we use our overlay system to make the image coincide with the patients, like this one. So you can see that from this window, so the surgeon can identify the target, the tumor, yeah, with the eyes. So you can see that this and the field show the tumors, like this one. So after during the operations, you can see this is area, is a tumor area. But even we open the skull, so we cannot identify the size of the tumors. So with our image and guidance system, we can make the tumor show in the 3D space. So you can see that we can identify the position of the tumor and even the size and the depth of the tumor. So, and the surgeon can perform the high quality and the treatment for the intersection of the tumors. So we also develop some marker and the 3D image and registration and the mask for the 3D and image and the overlay. And we use the stereo camera to capture the situation of both the image and the surgical, the image and the patient and the surgical tools. So you can see it here. So the image and show the overlay and the tools here. We can cutting the target with the guidance of this and the image is a kind of 3D and the image is the green one here. And then you can see it, we can get a identification of the target. So even we move and shift insert the instrument to the target, so you can see the area between the target and the instrument can be showed in our system. So you can see that this is the data showed, and when we move adjust the direction of the surgical and the instrument, it can be made a very high and real and intuitive and visualization for the surgical and instrument guidance. So we also develop stereo and the stabilization of the images, so we can move the overlay and the system. So here, even we move the overlay and the system, the image can be coincide with the patient. We don't need to move off to turn and the rotation and the displays here. So you can see that we can make a very special and high quality special and stabilization and for the image and the guiding and the surgeries. So we have another work on 3D and it's a high quality and 3D and see-through and the micro and the surgeon guidance. So you can see that we improve the optical and the systems. So you can see that we use a magnified image of the patients, like use to put some optical and lens here. So you can see we can improve the spatial and the resolution of the 3D and the display, 3D and the image here. So you can see that here I show some and the result here. The left and the video is a conventional and the method. So you can see the image is blue and in this area. The right side is our new and the technique is very clear in the detail and the structure and the display here. So this kind of display can be viewed in high quality with a large and the viewing angle and both and the quality and the viewing angles. So we also have some application on the orthopedic and the surgery like this one. You can see then from this viewing angle, the outside is the finger is a real and the patients. The second right is the overlay with the systems with enlarged and optical and the systems here. So this side is the image over the system with a high quality and the enlarged and the image. So we can get the more detail of the internal anatomy and structure of the patients, like this one. This is our development system and the surgical navigation system, and we made the device by ourselves. And lens has some application in the dental and the improvement. So you can see the surgeon can perform the improvement for with the guidance of our systems. So the surgeon can see through the patients to avoid the critical and the structure and make a high and quality and improvement of during the the clinical and experiments. Yeah. So, and the last I will show some application of the intelligent and the system, because then we have some and the 3D and the image, and also have and the image and get and for example the information get in join the operations with the optical and the image. There are a lot of in the optical image. So we combine and such and the 3D information and the capture and with the optical and the image and the techniques. So you can see then the application of the precision and the diagnostic. That means then we can combine with the integrate both the diagnosis and the therapies for the minimally invasive and the surgery. So you can see the precision and the optical image and the diagnosis. We can provide the information or during the operations. It's intraoperative and information. We can also realizing the control the treatment file and the method, and provide the intraoperative and the monitor and the feedback and for the treatment. So we use the Fiala. Fiala is kind of a Florence and information. So the information can be guided use robotics and the laser operation for the precision neurosurgery. You can see then from this side and the Fiala inside the patients, they move and to the tumors, and then when we put in the blue light is a laser, so they can emit the red in the fluorescence like this one. So with this picture you can see then this is the pictures, and there's real pictures here. So here is the information. It's red information identification the tumors here, like. So we have combined such a systems. We can make a spectral and the measurement for the tumor, even the small and the tumors. We can combine. We can compare the data with the information or the physiological and the informations. So we can make identification of the tumor and here. So we can make robotics and laser and operation and the system here. So this is our robot and scanning and laser operation system. We have 3 functions. For example, here is the excitation and the laser here, and this is a fluorescence and a detector, and this side is operation and the lasers. So you can see this is an enemy and the experiment show here. You can see we can use our robotics and the laser operation and the system to scan the patients here, scan the patient to identify the tumor, the position of the tumor, and then perform the laser operation for the tumor areas with very high and high quality and high resolutions. So you can see then all the performance can be performed automatically, even without the surgeons. So you can see then we can make automatical and the diagnosis and the treatment with our system. Even we made a small one, and we can combine the fluorescence and the diagnosis and laser and the treatment device here. So the device can be inserted patients and with the very deep side here. So you can see in recent year, we also combine the multi-modality and the optical and the image for the diagnosis like this one. So the work have been shown in the diagnostic, like, this is our systems. We can make we can make a mapping and relationship between the laser and the parameter and the tumor and the body. So make option and the treatment for the targets like this one. So some in vivo and the experiments or the diagnostic and the identification or the validation of the multi and the point operation the PASA. This is the result and show here is before and after the treatment. So they show some improvement of the treatment like this one. So this is my work and show and some and relate and work and research on the work on the 3D and the image and the 3D and the image and the guide surgery, and also have some and the image analysis for the operative and use. So our future work also and focus on develop some such an system with a 3D and the image and for surgeon that combine the micro and the robot, and even and for the tele and the surgery, and even for cover from the fetal and to the senior patients. The target is we want to improve and maintain the quality of the life. Thank you and for your attention. Thank you.
Thank you very much for this inspiring presentation. I wonder if there are any questions for Professor Liao.
Can you hear me?
Yes.
So,
yes, I think the Professor Liao's talk is really inspiring and very insightful. Give very good the introduction of the surgical robotics. It's nice to learn so much information. From my point of view, that there are many researchers in the field working on surgical robotic, maybe part of that, work on those projects, and they might have difficulties like patient motion correction can be a difficult task. It apparently that in Professor Liao's work, it seems the matching is very good. The predicted image and the actual image is matched well. So, can you give the many researchers some advice if they want to do the similar work?
Yeah, and for the image and the guide and the surgery, especially in the use and in the intraoperative and the surgery, and as you mentioned, and the movement of the patient is very difficult. Another is the deformation of the organ. So how can we get and the information, especially intraoperative and information of the patient, is very important. So there are two ways and to work, and one is combine the pre-operative information and with high quality and pre-operative information with the intraoperative information, such as you can use the ultrasound for the scanning of the patient during operations. Another end that we can capture use the camera, for example, the endoscope, so we can get the information and the patient during operations. So another one is the point is how can we make a high quality and the fusion? That means the fusion of the multi-modality and the image. For this means combine the two and the image for the use and with a high quality and for example a real-time image, so we can use and during operations. So for the application, and another is the point is during the minimally invasive and the surgery. Another and the good and the difficult and the point is to make how can we show the image and coincide with patients, because the images just show for the use for the surgery. So the surgeon, how can we get the whole information of the patient? That's very important. Yeah, because during the operations and there are a lot of the technique, but how can we make list and information and the medical image have a good visualization for the surgeon? I think we can work in this area and go more with in our futures. Yeah, thank you.
Okay, thank you very much.
We also have a question from Thomas Deserno. Please unmute yourself.
Yes, I was very impressed to see the progress you made from the first devices in 2000 until now. And my question is, say another 10 years from now, what will be reality in 10 years? What do you think?
That's a good question. And we have two things. Yeah, first one, just in the past 10 years, and we focus on how to make this device and use in the operate in the clinical. So we have some application in the clinical and for the neurosurgery, and for the dental and the surgery, and so and other areas. So for the next 10 years, and I think we can make more quality and high quality and the device. That's one point. Another is we can improve the interface for use during the operations, especially for the surgeons. So how to improve the quality? Maybe this kind of techniques based on the optical and the lens. We even we can have some new technique. That means the new 3D and autostereoscopy and the display with a more high quality and more high density and the pixel and the image, the voxel and all the 3D and the displays. And another one is how can we make such a system use in the operative. Now that means the surgeon have good which have to provide them a good interface for them to very easy to use during operations. That's our future work. Yeah, thank you.